history in dairy farming, where you have worked and what you have done in your career so far?
Yes, sir. So, I have experience here in the Philippines before 2010. I have a training for a TESDA, for accredited in TESDA about raising large ruminant as a husbandry here in the Philippines. So, I was in a dairy farm worker, general farm worker in milking, calving, fencing, and foraging pastures. Just only the basics for about almost 1 year. So I have a plan applying for Almaray. So very lucky, thank God that I have fulfilled the application. So I have work experience in Almaray for 2 years. I've been there for a milking department for about 1 year. So they got promoted me in my job. So they hired me again in this breeding department also in Almaray. So
Good.
that's why so I try harder for my experience. So now I need to make one more step to apply in New Zealand.
Okay, good. So you spent 1 year in the breeding department?
Yes, sir.
Good. Okay, so I'll just start off by going through the milking department. So what can you tell me about the milking procedure you followed in Almarai and especially about the detection of mastitis?
There in Almaray, so there's a big difference there that I practice here in Philippines in Almaray. So in Almaray, first we push the cow. Early in the morning, we push the cow from the house. We put there in the washing area, washing pen for 10 minutes, 3 rounds, and then we push again at the dry area, drying pen, and then we start for milking for a herringbone. So each house, we have 300 cow. So so there when starting milking, everything is automatic. So when the cow is already arranged in a herringbone, already clean, so we check for mastitis, if there's any swollen, if there's any blood secretion, if there's any like a yellowish color in this milking cow. So we separate this cow, then separate this cow, and then also we milk to avoid mastitis contagious. So we milk this cow. So in the milking procedure, we have one cow. We put clusters after this milk dry, already dry enough, not too much milking out. So we automatic this cluster, we pull out this cluster from the teats. So after we put some betadine or iodine spray. So we put again this cow inside the house.
Okay. And just around mastitis, so you strip the teats pre-milking, and what are you looking for as in signs that a cow has mastitis?
First we strip this cow because first the appearance, when you saw this other swollen reddish, so we strip this cow. We strip, but then if there's a presence of clotting of milk, blood clots or watery, so we just have to strip until the milk will clear. So actually we milk this cow to make this bad milk to let go. This bad milk goes. Only stripping and treating this cow.
Okay, that's good. And if you find a cow with mastitis, are you capable of treating yourself, or you pass on to another department?
First, we treat this cow for stripping, and then after, if this cow there's a mastitis, we separate this cow to the other fence. Then we will treat this one. We assist the doctor there in Almaray, this health department. We assist there to putting some antibiotics to this teats, or they make this, put some kind of needle to make this pores open, these teats, then make this all milk out and put some antibiotic on it.
Good.
Thank you, sir.
Okay, that's a good understanding. So just moving on. So then you have a focus on the breeding department. So what can you tell me about heat detection and some signs that a cow is coming on heat?
In breeding department, boss, first in coming in heat, there's first there's a rub off, and then rub off this cow, always mounting this cow to other cow. Then restlessness, we actually saw this cow restlessness, this like shouting, then running, walking, and then also there's this slime, presence of slime outside of this vulva, and then this the vulva of this cow is swollen, reddish, pinkish about of the appearance. That's the time we will EI that one. So if we saw this cow in heat in this morning around 8 o'clock, we will EI this one in the afternoon. So if we saw this cow, this cow 8 p.m., so we will EI this one in the morning.
Okay. And you perform the AI yourself?
Yes, sir.
So you know how to artificially inseminate a cow?
Yes, sir.
Good. And how many cows would you do a day in your position there in Almarai?
In my position there, I morning, because we have a morning shift and afternoon shift. Morning shift, I approximately maybe 15 cows to 20 cows morning. In the afternoon, maybe 15 cows or 10.
Good.
Thank you, sir.
Okay. And have you had any experience in the calving department, so assisting cows to give birth?
Yes, sir. And I experienced in calving in Philippines in Almarai. I only gather some knowledge there in Almarai. Actually, that is not my department there in Almarai in calving. But in the Philippines, we only assist doctors, especially there's a hard labor, assisting the doctor. We only do this normal delivery in calving. We wait for the cow to deliver by herself, and then after we treat this cow. This cow we only remove and then put this separate this calf inside this fence. Then this cow, this mother, we need to automatic immediately milk this colostrum so that to avoid mastitis.
Good.
Thank you, sir. Thank
Okay.
you, sir.
And so you have experience feeding that colostrum to the calves as well?
Yes, sir.
Okay. And what about tractors and machinery operation? Have you got experience driving tractors or motorbikes?
Yes, sir. I have also. I know how to drive four wheel vehicles. Also tractor. I also doing tractor there in Almarai. Only doing grass pushing to push this grass to feed this cow at the stanchion. And also I know how to ride bicycle and this 4-wheel drive.
Motorcycle?
Yes, sir.
2-wheel?
Yes, sir.
And what about an ATV, 4-wheel motorcycle?
I haven't experienced that yet, boss, but I will try my best, boss, to learn this one. But I know how to drive this motorcycle and this drive 4-wheel.
Okay, cool.
Thank you, sir.
And can you tell me about your personal situation, Laurence? Do you have a wife or children?
Yes, sir. I just got married last year and I have a boy, now 4 months, healthy boy. Yes, sir.
Good. And are you immediately available for placement in New Zealand?
Yes, sir. I can avail it.
Good.
Thank you, sir.
And you have a valid passport?
Yes, sir.
Okay. Cool.
Thank you so much.
Alright, Laurence, thank you for your time. That covers off everything we need to know today. Thank
Sir,
you.
Thank you so much, sir. God bless.
God bless.